Hi, my name is Pip. I'm one of the physios at Sydney Advanced Physiotherapy, and I thought I would make a video on a question that a patient actually asked me this week, which was, how much training do I actually have to do? Now, if you've watched any of our other videos, you'll know that for certain issues, you do have to actually do some exercise to resolve those issues. You have to retrain the muscles to work properly again. And you have to look at the way you move. And a lot of people are understandably looking for a quick fix. And I totally get that, but there are some issues where you actually need to address the way the muscle is working or the muscle group is working, or where you might need to add some extra strength in order to fully resolve those issues. Often we can address your alignment issues and your pain really quickly, but it does take a little bit of time to build muscles and to get them firing in the right pattern again. If you don't do this, what can happen is, yes, you're pain-free now, but it will come back within the next 6 months, 12 months, or what you experience is all of your issues are, for example, on the right side. It's very common that we see people come into the clinic and they've had a right shoulder issue and a right knee issue and a right foot issue, and oh, the right side of my back's also problematic. And they don't seem to necessarily be related, but it's because you didn't actually learn to hold your body in that good alignment, and there is some issue with your alignment that's causing you to overload one side of your body and therefore sustain repeated injuries to that side of the body. So when you're actually looking at how much do you have to do, how much time do you have to put in to get these muscles firing, to get things working again? Well, the research shows that it takes 2 weeks to use what you have better. We know that it takes 5 weeks to start making more muscle. So what that means is you have to be training 4 times a week, and you have to be fatiguing the muscle. So you have to be giving it a challenge that is really hard for that muscle and fatiguing it 4 times a week for a minimum of 5 weeks to start making muscle. So how much work you have to do depends a little bit on a couple of things. Like, number one, how quickly did you go and see a quality physiotherapist? So there are a few things in that are important. You need to see a quality physio and you need to go quickly. So when you have pain, that can switch off certain muscles. The longer they are switched off for, the more they waste away, so they atrophy and get smaller and weaker. The longer that goes on for, the more work you have to put in to make that muscle come back. Sometimes your alignment can be off to the point where it inhibits or reduces the function of certain muscles. And again, the longer you leave that, the harder that is to resolve, the more effort it takes. So the faster you get in to see a quality physio, the faster you're going to be able to resolve this issue. The other thing you need to understand is the longer those issues have been going on for, the more your body will have compensated to try and get around that issue. And that might mean a little bit of retraining in the way the muscles work. So trying to get them to turn on in the right order so you get the right support system. So that can take a little bit longer. So again, go and see a quality physio sooner rather than later. Number two, are you fatiguing the muscle you're trying to get stronger? So if you are trying to make more muscle or get stronger, you need to fatigue that muscle. And that means you need to work at a load that is hard enough to make that muscle tired. Now, for every muscle, that load is going to be quite different. The load it takes to fatigue your leg muscles is going to be very different to the load it takes to fatigue your teeny tiny multifidus muscle, which is a super important stabilizer of the spine. Often I find that people aren't working at a load that is high enough to fatigue the muscle, or they aren't being specific enough with which muscle it is they are trying to fatigue. And so that slows down the whole process. So the third factor is, are you doing your exercises often enough? And as I said before, you have to do something about it and fatigue those muscles 4 times a week for a minimum of 5 weeks to start making more muscle. The research shows that once you have the strength, you only have to do something about it once a week to maintain it. But there are a few little asterisk points that I would like to make here. You actually need to be able to turn on the muscle that you're trying to fatigue. So sometimes that will require you to do a little bit of work on your alignment first, or you might have to learn how to down train another muscle first, so to switch it off a little bit and back it off. so that a different muscle can actually turn on. Personally, I find down training muscles to be the hardest part of fixing an issue in my own body rather than gaining the strength. I find that that is much easier once I've got the alignment and the pattern of movement right. And that brings me to another point. Your technique on the way you execute your exercises is really important to fatigue the right muscles and to get the right effect. To make more muscle or to add strength, depending on what you're trying to achieve, you really need to be working at a load that you can control and do well for about 8 to 12 repetitions for a couple of sets. The aim is to really tire this muscle out. I can't emphasize that enough. To tire it out properly, to maintain your technique and control, and to do it a few times a week. A great physio is going to be able to identify areas that need to change, and they're going to be able to show you the most effective and efficient way to get that change. Now, there is no one strength program, one weights program that will fix that same problem in different people. It's really important to understand that different bodies have different issues, they have different injury history, they have different hormone backgrounds and hormonal fluctuations. Training a woman is very different to training a man, and you get different responses and different muscle adaptations. So it's really important to see someone who knows what they're doing to help guide you in your recovery from an injury. I often find that the best way to get the changes I want in a muscle is to give it varied stimulus. So to give it different challenges, and I find that the best way to do this is in classes where I'm able to supervise the people that I'm working with. And I know a lot of our physios also feel the same way, because otherwise we would have to give you a large number of exercises to do at home, and we'd have to be sure that you're doing them well, which can sometimes be the biggest challenge of all. Coming into a class like the ones that we run at Sydney Advanced Physiotherapy can mean that we can set you up with different challenges, different loads, different weights, different stresses on the Pilates equipment. And that can mean that we can give you different challenges in different positions and supervise you and make sure that you are executing them well and basically getting the biggest bang for your buck. But everybody is different, and there are multiple ways to go about it. If you need help with strengthening or adjusting the way your body is functioning so that you can get the most use out of your body and enjoy all the sports that you want to enjoy without feeling like things just aren't right, or without feeling pain, then come in and see one of our physios. You can book in online via our website, which is sydneyadvancedphysio.com.au, or you can call the clinic 9416 4410.